The clinical examination of the respiratory system is vital for diagnosing and managing respiratory disorders such as asthma, pneumonia, or chronic obstructive pulmonary disease. It helps assess lung functions, detect abnormalities, and identify early signs of severe conditions. Additionally, this examination provides critical information for treatments, monitoring progress of the patients, and improving patient outcomes. So, respiratory examinations include general physical examination and chest examinations. In general physical examination, we look at the appearance of the patient, nails, fingers, wrist, face, neck, abdomen, back, and legs. All these organs provide specific clues about certain types of disorders. So, you can see dyspnea on appearance. Dyspnea is actually a difficulty breathing which can be caused by respiratory diseases like asthma, chronic obstructive pulmonary disease, pneumonia, and pulmonary embolism. It may also result from cardiovascular conditions such as heart failure, anemia, and systemic illnesses like obesity or anxiety disorders. Tachypnea is an abnormally rapid breathing rate, typically defined as more than 20 breaths per minute in adults. It can be a sign of underlying conditions such as fever, respiratory infections, heart failure, anxiety, or metabolic acidosis. Cough is a reflex action designed to clear the airways of irritants, mucus, or foreign particles. It can be acute, lasting less than 3 weeks, or chronic, persisting for more than 8 weeks, and may indicate conditions like respiratory infections, asthma, gastroesophageal reflux disease, or chronic bronchitis. Hoarseness is an abnormal change in the voice, often characterized by a raspy, breathy, or strained quality. It commonly results from irritation or inflammation of the vocal cords due to conditions like laryngitis, vocal cord nodules, GERD, or prolonged voice strain, and may occasionally signal more serious issues like throat cancer. Wheezing is a high-pitched whistling sound heard during breathing, typically caused by narrowed or obstructed airways. It is commonly associated with conditions like asthma, chronic obstructive pulmonary disease, bronchitis, or allergic reactions. Stridor is a high-pitched, harsh sound heard during breathing, usually caused by partial obstruction of the upper airways. It is commonly associated with conditions like croup, laryngeal edema, foreign body aspiration, or tracheal stenosis, and often requires urgent medical evaluation. The patient may be using accessory muscles while breathing. So, accessory muscles used during respiration include the sternocleidomastoid, scalene muscles, and abdominal muscles. These muscles are typically engaged when the primary respiratory muscles like diaphragm and intercostal muscles are insufficient, which can occur in conditions such as chronic obstructive pulmonary disease or COPD, asthma, emphysema, and respiratory distress syndrome. The pattern of breathing refers to the rhythm, rate, and depth of breaths taken by an individual, which can vary based on activity levels, emotions, or health conditions. A normal breathing pattern is typically smooth and regular, while disruptions may indicate underlying issues such as respiratory or neurological disorders. Kinestroke breathing is an abnormal respiratory pattern marked by alternating periods of deep, rapid breathing and slow, shallow breaths followed by a temporary pause in breathing, which is also called apnea. Kusumal breathing is a deep, rapid, and labored breathing pattern typically seen in severe metabolic acidosis, such as diabetic ketoacidosis. It is the body's attempt to expel excess carbon dioxide and restore acid-base balance. Ataxic breathing is an irregular and unpredictable breathing pattern characterized by varying depths and rates of respiration, often with pauses. It is typically caused by damage to the medulla oblongata, often resulting from trauma, stroke, or brainstem compression. So, hyperventilation is a condition where an individual breathes at an abnormally fast and deep rate, leading to a decrease in carbon dioxide levels in the blood. This can result in symptoms such as dizziness, lightheadedness, tingling sensations, or even fainting. Now, on nails, you can see clubbing. Clubbing of nails is often associated with chronic respiratory diseases that cause prolonged low oxygen levels. Clubbing can be caused due to lung cancer, particularly non-small cell lung cancer. It can be caused due to chronic pulmonary infections such as bronchiectasis, lung abscess, or chronic empyema. Interstitial lung diseases can also cause clubbing like idiopathic pulmonary fibrosis, cystic fibrosis, a genetic condition causing persistent lung infections, and tuberculosis, which is a chronic infectious disease of the lungs. All these conditions can cause clubbing of the nails. Clubbing can also occur with cardiovascular or gastrointestinal disorders, but respiratory causes are the most frequent. Clubbing involves a combination of vascular, connective tissue, and inflammatory changes. In this case, there will be increased blood flow to the nail bed. Chronic hypoxia or inflammation leads to vasodilation and increased blood flow towards the nails. In step 2, there will be vascular endothelial growth factor, which is also called VEGF. There will be hypoxia and inflammation, which stimulate VEGF factor, promoting angiogenesis, where new blood vessels will be formed. In step 3, there will be soft tissue hypertrophy. There will be increased vascular permeability and cellular growth, causing thickening of the tissue at the fingertips. Then lastly, connective tissue remodeling, fibroblast activation and collagen deposition lead to the characteristic bullous shape of the clubbing. Then you have to see cyanosis in the nails. Cyanosis is the bluish discoloration of the skin and mucous membranes due to insufficient oxygenation of the blood. It is characterized into two main types, peripheral and central cyanosis. In central cyanosis, there will be blue discoloration of the lips, tongue, and mucous membranes. It can be caused due to respiratory disorders such as severe asthma, COPD, pneumonia. It can also be caused due to cardiac issues like congenital heart disease with right to left shunting like tetralogy of Fallot, methemoglobinemia, carbon monoxide poisoning. In peripheral cyanosis, there will be bluish discoloration of the extremities like fingers, toes, often with normal mucous membranes. It can be caused due to reduced blood flow as seen in case of Raynaud's phenomenon, shock or heart failure. Cold exposure like vasoconstriction reduces peripheral oxygen delivery. And in case of venous stasis, there will be deep vein thrombosis or other circulatory obstructions. All these cases can cause peripheral cyanosis. The changes in appearance of fingers such as clubbing or swelling of the fingers can indicate underlying respiratory diseases like COPD, lung cancer, or pulmonary fibrosis. Pain, swelling, and deformities in the wrist can indicate underlying conditions such as rheumatoid arthritis, carpal tunnel syndrome, or other inflammatory or degenerative diseases. On face, there will be changes in the face such as puffiness, discoloration, or rashes, which indicate conditions like rosacea, lupus, hypothyroidism, or kidney and liver disease. Swelling or lumps in the neck can indicate conditions such as thyroid disorders, lymph node enlargement due to infections or cancer, or vascular issues like carotid artery disease. Abdominal swelling, pain, or tenderness can indicate conditions such as gastrointestinal disorders, liver disease, kidney issues, or underlying infections like appendicitis or gastritis. Pain or swelling in the neck and legs can indicate conditions like sciatica, herniated disc, deep vein thrombosis, or chronic issues such as arthritis or peripheral artery disease. After physical examinations, then you have to do chest examination of the patient. So during chest inspection, we usually examine the chest for abnormal movements such as uneven expansion, sign of deformities, asymmetry of the chest, or scars, and observe the skin for any discoloration, swelling, or visible abnormalities that could indicate respiratory or cardiac problems. During palpation of the chest, the examiner gently presses on different areas to assess for tenderness, masses, or abnormal lumps, as well as to evaluate the symmetry of chest expansion and detect any signs of respiratory distress such as decreased vibration or abnormal movements. So percussion of the respiratory system involves tapping on the chest wall to assess the underlying structures, and it can help identify abnormal lung conditions such as fluid accumulation or trapping or consolidation, which may indicate pneumonia or masses. Auscultation of chest involves listening to the sounds produced by the lungs using a stethoscope. It helps to identify abnormal breath sounds. Wheezing indicates asthma or bronchospasm. Crackles suggest fluid in the lungs, as seen in pneumonia or heart failure, or absent breath sounds, which indicate a pneumothorax or pleural effusion. Then during respiratory examinations, the last part comes the investigation. So chest X-ray is an imaging test that provides a detailed view of the lungs, heart, and chest structures to identify conditions like pneumonia, tuberculosis, or lung cancer. CT scan or computer tomography is a more detailed imaging test used to examine the lungs and chest cavity for conditions like lung cancer, pulmonary embolism, or chronic obstructive pulmonary disease or COPD. MRI or magnetic resonance imaging provides detailed images of soft tissues, often used for assessing the heart, lungs, and blood vessels for structural abnormalities. PFTs or pulmonary function tests is a series of tests that measure lung functions, including airflow and ability to take in and expel air from the lungs, which is used to diagnose conditions like asthma or COPD. The electrocardiogram or ECG measures electrical activity of the heart and is often used to check for heart related causes of chest pain, such as a heart attack or arrhythmias. Echocardiogram is an ultrasound of the heart used to assess its functions, valves, and chambers, especially for diagnosing heart failure or pericardial disease. Blood tests can detect markers of the heart or lung disease, such as elevated levels of troponin or D dimer, which could indicate conditions like a heart attack or pulmonary embolism. These exams are typically selected based on the symptoms and medical history of the patient.